This is Dr. Joyce Knieff with Yggdrasil Naturopathic Medicine, and this is part 3 of how I would treat your autoimmune disease if you came to see me as a doctor. So previously we talked about how important it is to get yourself out of an autoimmune flare if you are in a flare, and then we talked about gut health and the gut's role in being able to modulate the immune system. Next, I'm going to talk a bit about hormones. And hormones is a huge topic in autoimmune disease because there are some hormones that we know very much influence autoimmune disease, and there are some hormones that we know influences autoimmune disease, but we don't know in which direction. So today I'm going to talk about one that's fairly intuitive, and that is cortisol, your stress hormone. We all know that with autoimmune disease, stress can be a huge trigger, either from stress triggering the very onset of your autoimmune disease or putting you into a flare or making things worse. The main stress hormone in your body is a hormone called cortisol. Cortisol is produced by your adrenal glands. And I know right now on the internet there's a lot of information about cortisol being not a great hormone. And in the context of chronic stress, maybe it's not a good hormone. But cortisol also has very important functions in the body that are normal. Cortisol is something that helps control your immune system balance, your blood sugar balance, your blood pressure balance, and your sleep-wake cycle. So cortisol is really important if you want to have a functioning immune system in a way that it's not going to attack everything that is yourself. With cortisol, a normal cortisol rhythm looks like a high cortisol in the morning, and then as the day goes on, it slowly comes down as melatonin comes up throughout the day and then peaks at night so that you can go to sleep. In up to 80% of autoimmune diseases, we will see that the sleep is disrupted, likely because this hormonal cycle is also disrupted. There have been papers that have been written about theories on rheumatoid arthritis, and the reason why pain is much higher for people with rheumatoid arthritis in the morning may be because of a delayed shift in the way that this cortisol rhythm is working. Cortisol itself is a steroid hormone, so it is immunosuppressive to a certain degree, meaning that with a lot of autoimmune conditions that are going on, cortisol as a hormone can actually lower that inflammation when it is in play. When you're in high stress and the cortisol rhythm is going everywhere, your inflammation is going to go out of whack. So if you can dial back and have your hormones regulated, a lot of the times that can help the picture of your autoimmune disease. What can be done with a cortisol and melatonin rhythm? Well, the easiest thing that can be done is to establish this daily rhythm, also called the diurnal rhythm, by exposing yourself to daylight in the morning as soon as you wake up. This causes your body to create that cortisol in the morning, and at nighttime to be able to put yourself in complete darkness, because that also gives your body the signal to lower the cortisol. From a more nuanced perspective of treating autoimmune disease, just having light in the daytime and darkness at night might not be enough if your immune system is really out of whack and really influenced by these stress hormones. So from a functional medicine perspective, what we can do is to utilize herbs or certain nutrients to be able to encourage the body to come back into this normal cortisol rhythm. And a lot of the herbs known as adaptogens will do this. A few examples really popular right now are things like ashwagandha, ginseng, eleutherococcus, rhodiola. All of these herbs are known as adaptogens that help with the adrenal gland and its regulation of cortisol. In autoimmune disease, however, you might need to be a little bit careful, because a lot of these herbs can have a promoting effect on either the Th1 arm or the Th2 arm of the immune system. And depending on which arm you have your imbalance in that is causing your autoimmune disease, you're going to want to be careful and make sure that you aren't over-promoting the one that is already out of balance in your autoimmune disease. This is where talking to an expert can be really helpful, somebody who understands the balance of your immune system with your particular autoimmune disease and be able to know what herbs work best for your individual constitution. Our clinic is located in Minnetonka, Minnesota. We are Yggdrasil Naturopathic Medicine, and we see patients that need this type of hormone balance all the time. And we are very much able to individualize treatment depending on the individual person, what autoimmune disease they're dealing with, and what specific hormone imbalance they might be experiencing in their lives. We do offer free consultations so that you have a chance to talk to our doctors, make sure that you're a good fit. We'll be able to hear your individual case because every individual is different, and we'll be able to give you an idea of how we would approach your case if we were to work together, and then we can see whether or not we're a good fit from there. Thanks.